All right, so today we're going deep, really deep into acute gastrointestinal bleeding.
Yeah, when your gut, well, it's trying to tell you something.
It's more than a hint, right? This is serious stuff.
Absolutely. We're talking about what happens when things go really wrong inside your digestive system. Bleeding that can be life-threatening.
And while it sounds pretty intense, even if you're not a doctor, this information, well, it can really empower you.
Knowing the signs, understanding what's happening, it helps you make informed decisions.
Exactly. It's about knowing when to get help for yourself, for someone you love.
Right, because we're not talking about a simple stomach ache here.
This is internal bleeding, and it can happen anywhere from your esophagus all the way down to your colon.
To really unpack this, we've got two in-depth research articles we're diving into.
One tackles bleeding linked to liver disease, while the other explores all these other surprising culprits.
Yeah, and it's amazing how much our understanding of this has evolved.
Right, we've moved way beyond, it's just spicy food, haven't we?
Absolutely. We're talking ulcers, tears, even something called Dieulafoy's lesion.
Okay, now that one, even the name sounds a bit terrifying.
Imagine a blood vessel in your stomach wall. It decides to become abnormally large. Think like a balloon that's about to burst.
And it can just rupture.
Exactly. It's rare. But when a Dieulafoy's lesion ruptures, it can cause sudden, massive bleeding.
Wow, okay, so definitely not something to ignore.
Exactly. That's why catching it early is so crucial.
Okay, so we're talking internal bleeding, potentially life-threatening, and it's clear this is a medical emergency.
Both articles really emphasize that early diagnosis, immediate medical attention, it's critical.
Okay, so let's break down these two main types of acute GI bleeding, starting with variceal bleeding, which is where the liver comes in.
Right, so picture this. You have high blood pressure in your liver. We call it portal hypertension.
Portal hypertension.
Yeah, that's a garden hose with way too much pressure, causing weak spots to bulge.
And those bulges, those are the varices.
Exactly. They're in the blood vessels of your esophagus and stomach, and they're at high risk of rupturing.
So it's almost like they're ticking time bombs.
In a way, yes, and that's what makes this type of bleeding so dangerous.
It's that potential for sudden, massive bleeding.
Right, and the research by Mohanty and Garcia et al., they stress how important it is to act fast.
Lower that pressure, stop the bleeding.
Exactly. Their management plan, it's all about speed.
Makes sense. Time is of the essence in this situation.
Absolutely.
Okay, so let's switch gears to the second type, non-variceal bleeding. This one, it's less about the liver, right?
Right, we're looking at a whole other set of causes here, things like peptic ulcers, tears in the esophagus.
Like a Mallory Weiss tear, those can happen after, like
Yeah,
forceful vomiting. Right.
exactly. Or even those vascular malformations we talked about, like Dieulafoy's lesion.
Okay, so for those listening who might not be familiar, what actually causes these ulcers and tears?
Well, it's actually pretty fascinating how our understanding of this has changed.
How so?
Well, we used to think ulcers were primarily caused by stress, spicy food.
Right, the old stereotype.
Exactly. Yeah. But now we know it's often a bacteria called H. pylori. That's the main culprit.
H. pylori, that's treatable, right?
Yes, and thankfully, treatment has become so effective that it's really shifted our focus.
So,
Other causes, things like the overuse of NSAIDs, for example.
and so you mean like everyday painkillers?
Exactly. Ibuprofen, naproxen, millions of people use them.
But you're saying they can increase the risk of GI bleeding?
They can irritate the lining of the stomach and intestines, and that increases the risk of ulcers and bleeding.
Wow. It's a good reminder that even over-the-counter medications, they can have side effects.
Absolutely, and that's something both articles highlight. Knowing your risk factors is crucial.
Right. It's not just about spicy food anymore.
Exactly.
So we know this condition is serious. We're getting a sense of what can cause it, but how is acute GI bleeding actually diagnosed?
Well, it can be. Both articles emphasize that accurate and timely diagnosis is the most important first step.
Of course, but how do they figure out what's going on?
The methods they use, it really depends on the type of bleed, how stable the patient is.
So it's like a medical detective story.
In a way, yes, they're piecing together clues to figure out what's happening inside.
So sometimes it's straightforward.
Sometimes it might be a bleeding ulcer that's easy to see and treat with an endoscopy.
And just for our listener, endoscopy, that means they insert a thin tube with a camera to see inside, right?
Exactly. It allows them to see the lining of your digestive tract.
Not exactly a day at the beach, but it can be life-saving.
Absolutely. But sometimes the source of bleeding is trickier to find.
Trickier how?
It might be hidden, like tucked away in the small intestine. That's when they might use a capsule endoscopy.
Okay, now this is fascinating to me. They can send a camera through your entire digestive system.
Pretty much, it's a tiny camera you swallow. It takes pictures as it travels through.
Wow, the things technology can do. So depending on the bleed, different tools to pinpoint the source, but what happens once they find it? What are the treatment options?
Well, there's quite a range. Medications play a role. We've talked about PPIs.
And those are powerful acid blockers, right?
Yes, but then there's also what I like to call endoscopic wizardry.
Endoscopic wizardry. Does that involve spells and potions?
Not quite, but it's pretty close to magic.
Okay, I'm intrigued.
They can use these tiny clips to close off bleeding vessels, bands to stop the blood flow, or even heat therapy to cauterize the area.
Wait, they can cauterize from the inside. That's incredible.
It is, and then of course there's always surgery, but that's usually a last resort.
When other treatments haven't worked or it's a very severe case.
That-
So it sounds like managing acute GI bleeding is a real balancing act.
It is. Doctors have to consider so many factors.
The type of bleed, the patient's overall health, the risks and benefits of each treatment.
It's definitely not one size fits all.
And that's why having a skilled and knowledgeable medical team is absolutely essential.
Couldn't agree more.
We talked about ulcers and tears and all that endoscopic wizardry, but let's go back to those NSAIDs for a sec.
Sure.
It's kind of wild to think something so common could be risky for GI bleeding.
It is. When we talk about NSAIDs, we're talking about medications millions of people use, like every day.
Right, for pain relief.
Exactly. Ibuprofen for headaches, naproxen for arthritis, that sort of
They
thing.
work wonders for pain, gotta give them that.
They do, but the thing is they can irritate the lining of your stomach and intestines.
And that's what ups the risk for ulcers and bleeding.
Exactly.
So it's not always about what we eat, sometimes it's the meds we're taking.
Right. And it's easy to forget that even over-the-counter meds can have those side effects.
It's like we think, oh, it's over the counter, it can't be that strong, but...
But our bodies, they react differently to different things.
Exactly. So knowing your own risk factors, that's key here.
Absolutely. If you're popping over-the-counter painkillers all the time,
Which, let's face it, a lot of us do.
it's worth talking to your doctor, seeing if there are other ways to manage that pain.
Right, because it might not be worth the risk.
Exactly.
Okay, so let's shift gears a bit, talk about treatment.
Okay.
We covered some techniques for stopping the bleeding, but what about the big picture, the overall management of this?
Right. Well, both articles really highlight that managing this condition, it's a real balancing act.
How so?
Well, it's not just about stopping the bleeding. It's about figuring out what caused it in the first place.
So you're looking for a root cause.
Exactly. And making sure the patient is stable.
Okay.
And that often involves a whole team of specialists.
Oh, wow. So it's not just one doctor.
Not always, no. You might have gastroenterologists. Those are the digestive system experts. You might have interventional radiologists. They can do those minimally invasive procedures.
We talked about those. Pretty amazing stuff.
It is. And of course, if needed, there's always the surgical team as well.
So it's a real team effort.
It really is. And that's important for your listener to know.
But it's that.
That if they or someone they love is dealing with this, they need to advocate for themselves.
Don't be afraid to ask questions.
Exactly. Get a second opinion if you need it. Make sure you feel good about the team that's handling your care.
That's such good advice for any medical situation, really.
It is. You got to be your own advocate.
Okay, before we wrap up this deep dive, I want to circle back to something else the articles touched on, interventional radiology.
Oh, right. The minimally invasive stuff.
Yeah, it seems like that's becoming a bigger and bigger part of managing GI bleeding.
It is. It's constantly evolving, which is exciting.
So what's on the horizon there?
Well, for example, instead of open surgery, they can now use imaging to guide catheters, deliver treatment right to the source of the bleed.
Wow, so less invasive, quicker recovery.
Exactly.
It's amazing what they can do these days. It really makes you
Look
wonder,
at that.
could this be the future of GI bleed management?
It's definitely possible. Those minimally invasive techniques, they have a lot of potential.
It's really amazing when you think about it, right? We've gone from blaming spicy food to using these tiny cameras and high-tech procedures to treat internal bleeding.
It speaks to how quickly things are changing. The field of medicine, it's constantly evolving.
Exactly. And it's not just about the technology, our understanding of the body, the causes of these conditions. It's all evolving.
Right. And that's why it's so important to, well, to stay curious, stay informed.
Absolutely. Whether you're a doctor or, well, just someone who wants to take charge of their health.
Exactly. Because what we know today, it might be different tomorrow.
So true. So as we wrap up this deep dive into acute GI bleeding, what are the key things you want our listeners to remember?
Well, first and foremost, acute GI bleeding, it's serious.
Yeah, this is not something to mess around with.
Exactly. But the good news is early diagnosis and treatment, it can make a huge difference.
So don't ignore those symptoms.
Right. If you think something's wrong, get help.
Absolutely. Better safe than sorry.
Always. And the second thing, and this goes back to what we were saying before, knowledge is power.
Knowing your body, knowing the risks.
Exactly. We talked about medications, underlying health conditions, all those things factor in.
And if you know your risk factors, well, you can make better choices.
Exactly. You're taking charge of your health, potentially preventing something serious down the line.
That's a great point, and it's empowering to have that knowledge.
It is. And finally, don't be afraid to ask questions.
Of your doctor.
Yes, get a second opinion if you need to. Stay curious about new treatments, all that.
Because like you said, things are changing all the time.
They are. And who knows, that groundbreaking treatment, it might be right around the corner.
Such a good point. The future of all this, the minimally invasive techniques, it's pretty exciting.
It is definitely an interesting time for medicine.
Well, there you have it, a deep dive into the world of acute GI bleeding.
We covered a lot.
We did, from the symptoms and causes to the treatments, even a little bit of endoscopic wizardry.
Had to throw that in there.
Of course, but remember everyone, knowledge is power when it comes to your health, so stay informed, stay proactive.
And most importantly, take care of yourselves.
Couldn't have said it better myself.